looking at it through a structural lens or having a structural analysis basically is, again, a glorified way of saying that you're looking at the root causes of these factors and how do you understand why these things exist at a point in time and persist over time. If we look at a lot of the disparities and inequities, these are things that have lasted for a century plus. If we're thinking about interventions, you have to understand the historical and structural context that has allowed these differences to persist over time. And in fact, one of the things that we've learned over time is sometimes when we try to do interventions for a specific population without looking at what are the structural conditions that are associated with those markers of difference, we actually tend to exacerbate or grow the disparities, not shrink them, which was the original intention. And these are a couple of quick examples for when those kinds of things have happened.
In most of our large institutions, our universities and government institutions, let's say an RFP becomes available, a grant to do health equity work. Most of the time, we're going to feel pressure to get that grant in on time because there's going to be a short deadline. And so as a result, we're not going to make adequate time to involve community in the decision-making process because we're going to feel urgency to get the grant in. And with that decision to kind of do all of the planning work just exclusively within the institution, we have now hoarded all of the decision-making power within the white-led institution, and we have excluded the community from any kind of power. And usually the next thing that's going to happen is that we get the grant, hopefully, and now we've created some new job opportunities in association with this grant. People who are going to do the intervention, who are going to do the research. Chances are those jobs are going to come through our institutions, which are highly regulated in terms of how they hire, civil servant laws, different kinds of regulations and rules and processes. And as a result, probably it's going to be very hard for folks who are not already connected to the white-led institution to have access to these new opportunities. And so now what we've done is we've also hoarded the majority of these opportunities within the white-led institution instead of sharing them with the community we're trying to work in. And then lastly, what's probably going to happen is, we're going to first have to pay ourselves, and there's going to be all kinds of very expensive indirect fees and administrative fees. We're going to, probably have union negotiated high fringe benefits. We're going to also have to work with a subset of contractors that have already been vetted by our institutions, and they're probably also white-led. So if we need graphic design or catering, we're going to be giving money to other white-led organizations. And so as a result of all of this, the community in question will probably only get some services that they never asked for, delivered by people who are not from their community. And the white-led institution has hoarded all of the resources, all of the power, and all of the opportunities associated with this new grant. So for instance, I think it's really important to notice in this country that for decades, the amount of income that you are likely to have access to is very much determined by your race. This is in part because of differences in educational background, but this is also in large part because of a phenomenon that has been described as occupational segregation, where certain racial groups tend to be kind of targeted or funneled into lower paying jobs, and certain racial groups have much easier time accessing higher paying jobs. And so as a result, decade after decade, we see this kind of consistency in economic outcomes. I also want to remind people that home loans, which is a very important way for building wealth historically in this country, are not accessible equally across races. What you can see here, this study from the Pew Research Center shows that over the last 15 years, we have significant disparities documented by race in terms of who can access home loans.
These patterns in racial residential segregation and poverty concentration are not accidental. They are traceable to systemic racism in housing. One practice was redlining of residential areas, and this was a practice that started in the 1930s by the Homeowners Loan Corporation. And what they did was designate quote unquote hazardous areas in red. And neighborhoods with greater numbers of Black people were more likely to be redlined, even when compared to neighborhoods with similar levels of income and the type and age of houses. So Black areas were considered to be undesirable simply because the people living there were Black. White people in those areas were encouraged to sell rather than to hold on to those properties. This resulted in white flight and the further isolation of Blacks. That made it more difficult for people living in those areas to take out loans, which also led to systematic disinvestment. And importantly today, these red line communities are still predominantly Black. They have higher levels of poverty, and their residents have shorter lifespans. Another period of US history that has important implications for racial inequities in health is slavery. This is a map of the concentration of slavery in the US South. Slavery was quite common. About 1 in 3 white families owned slaves in the US South. But here again, the concentration of slavery was not distributed evenly. What Michael Kramer and colleagues found is that current day patterns in heart disease mortality map onto differences in slave concentration. So disinvestment in areas with larger former slave populations have led to structural disadvantages that continue to have ramifications for health today. So I bring these examples up because I think understanding health and health inequities requires not only understanding current characteristics of individuals, but also history